My name is Sheldon Schuster, and I'm the president of the Keck Graduate Institute. And I'm really thrilled this afternoon to be joined on the podcast today by Dr. Mary Ellen Cosenza, who is a regulatory consultant with more than 30 years of senior leadership experience in the biopharmaceutical industry in the United States, in Europe, and in emerging markets. Most recently, she served as the Executive Director, U.S. Regulatory Affairs at Amgen. During her 20-year tenure at Amgen, she led the International Emerging Markets Regulatory Department and served as an Executive Director of Global Regulatory Affairs and Safety. In addition to her leadership roles in regulatory affairs, she also served as a Senior Director of Toxicology at Amgen. Prior to joining Amgen, she served as Principal Scientist for the Medical Research Division of American Cyanimid Company, which is now part of Pfizer. It's a real pleasure to welcome you, Mary Ellen, and thank you for your willingness to talk to us this afternoon about your background and your career. Let me start out by asking just to give a little bit of history as you worked for Amgen for all those years, because I know our students and alumni are very interested in that Amgen experience specifically. How did you get there? What influenced you, and what got you into the whole area of regulatory affairs? What was the stimulus for that sort of stuff?
Shelley, first, thank you for having me here. It's really a pleasure to be visiting here at KGI and to interact with the students today. It's been a great experience. So I guess first, to take a step back, what brought me to Amgen, the company I was working for in New York at the time, American Cyanimid, had been taken over by American Home Products, which became Wyeth, which is how it eventually became Pfizer. And so they were going to move us. I was going to have to move. I had never thought about leaving the New York area. I was born a New York City girl and really hadn't thought about moving anyplace else. And certainly California was not on a list, if there was any list. But, the world was changing of the pharmaceutical industry, and Amgen was, one of those really fast-growing biotech companies. And somebody knocked on my door, so to speak, and said, we'd like you to come out to California and interview. I remember going to my husband that evening and saying, don't let me go out there and interview if you don't think we're going to, really consider seriously going. It really wouldn't be fair to them to do that. And he said, no, if this is the right job, I'm willing to go. So I went on the interview, and, the rest is history. It was just the culture there, the enthusiasm, the energy at Amgen was just so enticing. And so different than really, traditional big pharma, East Coast big pharma at the time. And so we figured we'd take a chance. We didn't really think we'd stay this many years in California. And I, who knew what would happen with Amgen? Honestly, it was interesting. One of the things, the first week I started there were rumors of Amgen being taken over. But of course, that never happened, fortunately. And, Amgen, we, bought other companies I was there. So it was a great experience. It was 20 wonderful years. Early in my career, I had thought about moving into regulatory affairs, sort of when I was first thinking of getting out of the lab, so to speak. But at that time, regulatory seemed very focused on sort of the paper aspect of it, because back then everything was paper, right? It was a big part of regulatory is putting together paper. Yeah. I've heard of that. Yeah. I remember watching a truck go off with the NDA, and it was a moving truck filled from top to bottom, as deep as it goes with boxes.
Now it's a thumb drive.
Right.
So,
now it's a few thumb drives, or everything goes through the portal. So that's definitely changed. So, early on, obviously that wasn't going to fit for me. It wasn't close enough to the science. After being in toxicology at Amgen for 10 years, I had gotten to a position where, I had a strong leadership position and felt confident in what I was doing scientifically, but there was a need in regulatory at the time. I was asked to go over and help build a group focused on early development and really bring a scientific focus to that part. And by that time, regulatory affairs had really changed throughout the industry to really being a strategic partner in drug development. And so I was able to come in at a leadership role where I was able to blend both my scientific background, my leadership skills, and, bring this focus on sort of this more global strategic partnership role.
Let me ask you, so as a consultant, what are the biggest differences you see by being an independent consultant and working for the giant mega corporation with all the resources and expertise? And what do you like the best about what you're doing now as well?
So what I really like about consulting is that I sort of get back into the day-to-day science again. I don't have the resources, as you said. I'm really advising people how to use their resources. And so that's, one of the big differences. They don't have to take my advice. That sometimes can be challenging. But I try to help companies use their resources wisely and how best to use them. And so, that's one of the things that makes it challenging.
We tell our students all the time, we talk about the fact that there is no substitute for experience. And of course, the cynical definition of experience is it's what you get when you didn't get what you wanted. But when we're not being quite so cynical, what kind of experiences did you have that were really important in shaping your career and you moving forward in leadership positions?
That's a tough question. I think being able to blend science and leadership can be challenging. And one of the things that became obvious to me in my career in the pharmaceutical industry in general, not just particularly at Amgen, is that sometimes the best scientists don't make the best leaders. And so if you have really good leadership skills, I think you can do well in a scientific field because there's just not plentiful. It's just not a plentiful skill. So that, I think that is one thing I learned. And so I was able to sort of play to that strength. Another thing I always tell young people is to, let the data speak to itself. I think sometimes what happens with scientists, they become so passionate about their science and their data. They feel so vested in that they don't like to see things fail. And as you know, science is a lot of failure, as is life. And if you don't, recognize those failures, you won't learn from them. And so that was one of the best pieces of advice I got was let the data speak for itself.
Often, we have many students who obviously come with PhDs or advanced degrees, and they talk about wanting to move into a career off the bench. You did that. I mean, that was your sort of pathway. Any advice for those kind of students about what areas to look in? Obviously, regulatory affairs would be obviously an exciting one that you've been in. Any other areas that you think make sense for them? Because given they all come with a very strong science background, and I think as you just pointed out so accurately, that's only a piece of the puzzle. Right, it's an important piece, but it is only one piece. Are there any other skills they should work on developing, can develop that would and it would put them into various areas in a big corporation like an Amgen?
Yeah, so I think the other skill besides leadership that's really important in drug development is teamwork, and so one of the things I always try to do when I work with students is get them to work on projects in teams, and often they'll say, "Oh, but if I work in a team, you won't really know how good I am." Well, sure I will, because your team will be successful if you're successful. And everything is done by teams. And so the ability to be able to work on a cross-functional team is key. I think areas that people who have strong scientific backgrounds that could move into besides regulatory affairs is project management or other types of team leadership roles would be just a couple of examples. But I think the other skill is clearly teamwork. And even as a consultant, I have to often work as a team because I just, represent one aspect of the development, particularly if it's a new company. They'll have maybe a PK person or a clinician that's working on the team, and we have to work as a virtual team. And if I didn't have that experience of having worked on real in-person drug development teams, I think it'd be hard for me as a consultant to, feel comfortable working as a virtual team.
Yeah, I think that's extremely solid advice, and I can't imagine doing anything without a team. As a matter of fact, so yeah, I deeply appreciate it. We do get comments every once in a while that, not all the members of the team work well. Welcome to the real world, right? And that's exactly what you're going to have to deal with in the real world, and you're going to have to make it happen. So I really appreciate that level of advice. Let me ask you, you're an expert in not just FDA regulations and U.S. regulatory affairs, but also you've really been involved in European EU regulations and regulations in developing countries. How do you look at all that, and what do you think the future is going to be? Is it going to all be like the FDA, one big homogeneous world, or going to be very different and fragmented? What do you think is going to happen?
That's a great question. I have seen a growing sense of harmonization. So ICH, obviously led the way with that. And I actually got to work on an expert working group for ICH. I worked on the M3 multidisciplinary guidance. And that was a multi-year project. So I got a lot of experience seeing how the ICH process worked, because we had to report every quarter to the steering committee on where we were and what was going on. So it was really interesting. It's kind of like a little model UN situation where people sit, in the booths with the headphones and the translators. And of course, one of the great things that's happened over the last few years is ICH has really expanded to more countries. So many, many countries, including China, have signed on to being participants in some way, whether it be observers or, different levels of engagement. So I find that very optimistic, because there was a time maybe 10 years ago where we were having all these sort of sub-regional areas, in the Middle East, and then Asia separately were all trying to make their own sort of conferences or councils of harmonization. But I'm optimistic that we'll see something more broad. And I don't know that the world will ever have like a World Health Organization that actually approves drugs around the world, because, the practice of medicine is so different in different countries, and different countries have different focuses. One of the things I learned when I went to many of these sort of emerging countries was they have health issues that we don't even think about very much in this country anymore. When I went to South Africa, the head of the drug review division said to me, she was supportive of many of the drugs that we were trying to get approved in South Africa for Amgen, focused on, oncology. She said, but I have a population that's dying younger of HIV, TB, and malaria. If I solve those problems, then we'll have, a population of people that will need, these other medications. So I think, that's still going to, play into the whole drug approval and healthcare in general.
If you were put in charge, let me make you the head of FDA. What kind of changes would you make to make things better?
I mean, we need to pay the scientists there, a salary that's more commensurate with their peers in other, in the industry. So I think that would go a long way. They need to have the tools, the computer tools and other types of tools that industry has, if they're going to be able to really engage as an equal partner. Honestly, I think Scott Gottlieb has done an amazing job the last couple of years. I've been pretty impressed, and I think most people would. And I think, they always say the proof is in the pudding, but the pudding's looking pretty good right now. I think the other challenge for FDA is that we have all these new modalities and, cell therapies and gene therapies. And I think, rightfully so, Dr. Gottlieb announced just a couple weeks ago they're going to hire many more reviewers, particularly focused on cell and gene therapy, and I think that's much needed. So I'm not sure I would do a lot different than that, except make sure they have the resources and the appropriate pay.
Yeah, I agree. I think it's too easy to make the FDA the enemy, and they're not. I mean, I think we all want safe and effective drugs. I mean, we're all consumers as well as producers, and no one I don't think anybody in the industry that I know wants to be part of anything that's not safe and effective. It's a very high bar, but it's a very important one. So I totally agree. They're the allies. I mean, they really are the last stop. I was recently reading, I don't know if it was intended to be criticism or whatever, of the regulatory agencies in terms of approving some of the pain relief medications. I know that's not your particular area, but any thoughts on that? Because obviously a lot of cancer patients are consumers of pain medications appropriately. There's nothing inappropriate about it at all. Any thoughts about how that kind of process could work, would work? Again, what are your insights into that from a regulatory framework?
Yeah, it's a really tragic situation. When those drugs first, were being developed, the the oral opioids for cancer patients, it was a godsend for many of the late-stage cancer patients who were, in really terrible pain that couldn't be relieved. I think the problem is not with the drugs themselves, but, with the way they've been marketed, the inappropriate marketing, quite honestly, and the way the whole, the doctor industry relationships there. I feel fortunate that I never had worked for a company that was involved in any of that. And so, it's really unfortunate because I think it's the people who are most vulnerable in our society that have become, victim to the inappropriate use.
Yeah, I think you really have nailed it. I mean, I think the system is so inappropriately utilized, and the poor people that are in pain are in pain. I mean, they're not making that up. It's really just it's a truly sad situation. Let me ask you, sort of more personally. You went to CCNY as an undergraduate. What got you from there to St. John's?
So undergraduate, I went to Queens College, which, as you said, is part of the City University of New York. I came from a family where many of my parents and aunts and uncles had gone to other City University of New York schools. My father went to City College and Brooklyn College for graduate school. He was a chemist. So I had, a good view of the City University system. And quite honestly, the price was right. I think my first semester tuition was like $333 for the whole semester. And, Queens College in Science had, at that time in the 70s, had a stellar reputation, high acceptance rate to medical school, which, I wasn't interested in going to medical school, but I knew that meant it had a strong science department. And so in terms of going to St. John's for graduate school, that was a different time in my life. I went to work right out of college. I actually went to Sloan Kettering, my first job. Thought I was, like we were speaking earlier, thought I was just going to go and cure cancer. Realized pretty quickly that I was a pair of hands in the lab, and that if I wanted to really do something, I needed to go back to graduate school. But in the meantime, I had gotten married and had a house and couldn't just go back to school full time. And St. John's had a program, a master's at the time first. I did a master's in toxicology and eventually went on for my doctorate. But they had a program where you could take your classes at night. The classes were 6 to 8 and 8 to 10. And so I could work and go to school at night, and eventually had, support at work where I could do lab work at where I worked. And anyway, so I was really blessed to have a lot of support both from my family and from work to be able to work and go to school. But that's really how I wound up at St. John's. It was just the logistics and location and the timing.
Fortunately or not, life is in charge, right? There's no question about it. But, you really did come from a really, obviously, a sort of a fortunate situation, because the city of New York is so good at providing those educational opportunities, and I'm really glad you did. So after St. John's, then did you go right to Pfizer, or what was your path after that? How did you navigate?
So I did my doctorate at St. John's while I was still working full time up at American Cyanimid. Okay. Yeah, and they were very supportive. I had a director of toxicology there who basically gave me free run of the labs, and I would actually go in on weekends and do my lab work. And then I did some work at St. John's as well. It was really on my way home, which is one of the things that made it doable, is I could leave work, go right to the school, take classes or do lab work, and then head home. So, and I would have stayed there. I think I would have stayed in New York at American Cyanimid if they hadn't been taken over. I was happy there. My family was in New York, but who knew? Sometimes life gets in the way of life. And anyway.
Well, I hope when they recruited you to Amgen, it was one of those beautiful days on the beach, and they used all of those tools to influence you. That it wasn't just Amgen, it wasn't just George Rathman being a phenomenal leader, but it was obviously an incredibly great place to sort of live as well. So I hope that was part of the inducement to come out to California. And you work your way up through Amgen to some very, very senior leadership positions. Did you have mentors? Were there people that guided you and gave you advice during that time? And what kind of person did you look for as a guide or a mentor?
So yes, I had several mentors over the years. You can't be successful alone. I always tell people you get mentorship above to your sides and sometimes from below. So, I was lucky that there were occasionally people who saw a spark in me or something that they thought I could do something different. Take on an international assignment, for example. I mean, I never would have probably gone out to seek that particular role. That was a real stretch role. But, but I also have to say, I learned many times, I had the opportunity to also mentor younger people at the organization. And I would tell each and every one of them, I learned something from them as well as, hopefully they learned something from me. So it goes both ways.
Well, I know you're one of our favorite instructors and professors on the BioCon program, so we all learn more teaching than certainly the students do listening to us, and that's one of the wonderful parts of being a faculty member, of course. What other guidance do you give young people? What would you tell these or what did you tell these bright young future looking young folks about what their career, what they should be looking for in careers, and what they should bring to it that would be special and move them forward?
Well, one of the things is not to be afraid of change and not to be afraid of failure. You have to learn from it and move on, but not dwell on it. I think another thing is sometimes when people have a choice, I often tell people that they'll say to me, "Oh, Mary Ellen, I can't decide between these two jobs, or should I stay in this job and being offered something different?" Sometimes it's good to do the thing that feels uncomfortable because you grow more when you're challenged. You grow more when you have to step up. Staying someplace that's comfortable can be great. And sometimes you have other things going on in your life. You have young kids, and maybe that's not the time to make that kind of change. But there are, other times when it's the right time, and you shouldn't stay stagnant too long. And you really need to sometimes take that leap of faith. And you'd be surprised how, the other thing I always remind people is that sometimes when you say you're going to make a change, doors will open you don't even know are there. Because until you sort of take that step forward, or you tell somebody, like when I wanted to do my doctorate, and I said to people, I think I'm going to go back to school again. And people said, oh, that's a great idea. Just let me know if you need to use this lab or if you need this piece of equipment. I mean, I never would even thought to ask, but people will, are inspired when you want to make that kind of change. And so you get help from places you don't expect it.
I think that's fabulous advice. Sometimes you have to just step out and see what's out there, even if you're not sure you want to step out. I mean, I think that's absolutely fabulous advice. Did you run into any special problems being a female in the scientific workforce?
Did you ever watch Big Bang Theory?
Yeah.
Sure. I mean, different problems, different stages of my life. I would say that in school, I was often the only female in certain classes, particularly my chemistry classes and chemistry labs. I remember one particular class, I was the only female in that, not in the whole class, but in that lab section. And some of the guys were pretty brutal, quite honestly. But I didn't recognize at the time that they were probably more threatened by me than I was of them. I just felt sort of like insecure, like how come I'm the only female here and maybe I'm not as smart as them. Instead, they were probably thinking, oh, she must be pretty smart if she's, the only girl in this class. So, I think different things over different times. And even when I was in pretty senior roles at Amgen, again, I never felt discriminated against because I was a female, but it was just more that I was often the only female at the table or one of two. And so there's, you just sort of look at yourself differently. You watch what you say more because you feel like you're not just representing yourself, but you're representing all the other women in the organization. And that's not always a comfortable place to be. So I would say that's probably more what the issues were.
Yeah, I think again, from my talking with female scientists all the time and female leaders in the industry, I think that's what we hear a great deal, and it is that being one is not. It's not comfortable. I mean, there need to be half and half. I mean, we are as a as a species, as a society, whatever it is, it's roughly equal. And being in these kind of situations, it really is quite strange, I have to say, which is one of the reasons why our leadership team is actually, I don't know if it's exactly split 50-50, but it's pretty close. And I think it's important that we do that kind of thing and really sort of assure that that's part of our culture and who we are. So I really appreciate that. Any parting sort of advice you would give to young people looking at their careers? You've had a really rich set of experiences, both in large corporations and now obviously on your own. What do you tell young people when they want to look out and say, what's the future going to be? Because we get a lot of sort of uncertainty. I think, as you said, gee, do I take this job or that job or things like that? A lot of uncertainty out there saying, well, will there be jobs? Will there be this kind of thing? And of course, none of us have a crystal ball, but it just seems to me that your experience is so rich that you probably have a lot of insight and help them in saying how to think about the world.
So I would say always be a student. Even those of us a little over the average age of students here, we are constantly learning, and you have to constantly be learning, constantly be reading, be curious. It's a great big world. There's a lot to learn. And a lot of it's just things you have to learn by doing. You have to go out and meet people, go places, experience different things. And those are the things you can't get by just studying harder. You have to actually experience those. So, be open to new experiences, new opportunities, new places, new things, new people. I think, that's one thing I would suggest. And, never think you're too old to learn, and never be afraid to go back for more school or whatever, or online learning or whatever. There's always new things to learn. And I think that constantly wanting to be a lifelong learner is really, really important. And learn something totally different than what you do. Learn a new language. If you don't play a musical instrument, learn to play a musical instrument. I play the flute. We didn't talk about this much in terms of hobbies or other things, but I find that when I'm playing the flute, especially when I'm playing with a group of people, and I play in a little jazz group with other toxicologists, we call ourselves jazzicology. When I do that, I can't do anything else. I can't be worried about, paying the mortgage or, I don't know, whatever's going on in Washington, D.C. Because when I'm playing music, and especially when I'm playing with other people, I can't focus on anything else. So it's a unique experience, and you learn a lot about teamwork when you're playing with a group of people. It's a great stress reliever because you can't, worry about a lot of other things. But I think it helps with a lot of brain connections, just learning something new. So constantly learning something new like that, I think helps keep stretching your brains. Learn to play chess. All these things I think will really help you in ways you can't really predict in life. So that's my general advice to students.
Sounds like absolutely fabulous advice. And Mary Ellen, thank you so much. This has been great fun. And we want to thank you from KGI, from all of us, for everything you've done, everything you continue to do. And we're thrilled to have you as a member of the team and the family.